Hi, I'm Christopher Kent. Your August issue of On Purpose is on the way. This month's show features dozens of informative articles. Here's a sampling of what's coming. First, upper cervical chiropractic care for a 16-year-old male with bipolar disorder, attention deficit hyperactivity disorder, and vertebral subluxation. This is the story of a 16-year-old boy who suffered with symptoms of bipolar disorder and attention deficit hyperactivity disorder since he was 6 months of age. His mother reported that he was born with the umbilical cord around his neck and forceps were used to assist delivery. The child experienced frequent accidents and medications were prescribed, including antipsychotics, as well as slow-release stimulants for ADHD and depression. The patient suffered with these symptoms since he was age 6 months, and now he's 16 years of age. The patient began having suicidal thoughts and threatening people. He was placed in a juvenile psychiatric institution in an effort to control these dangerous actions. Thankfully, his parents brought him to a chiropractor where he received knee, chest, upper cervical care. After 7 weeks of care, the patient's symptoms were eliminated or greatly diminished, and he no longer required any medications. This is why telling the chiropractic story is critical. Imagine what suffering might have been avoided if his parents knew. Imagine the tragedy that could have occurred without chiropractic care. The second story is resolution of trigeminal neuralgia in a patient undergoing Atlas orthogonal chiropractic care, a case report. A 54-year-old male presented with right-sided facial pain along the distribution of the mandibular branch of the trigeminal nerve. He had been suffering with this for 5 years. 2 days following the initial adjustment to the Atlas, the associated pain reduced significantly, and after 1 month under care, the patient no longer experienced any pain associated with trigeminal neuralgia. Neurological mechanisms are described in detail in this report, and as you know, some critics have challenged the notion of chiropractic care for cranial nerve problems. This article discusses the relevant neurological mechanisms and helps provide you with the rationale for chiropractic care in individuals with cranial nerve dysfunction. Next, we have resolution of neurological symptoms related to a myelopathy after receiving chiropractic care. This is a case report of a 51-year-old female with neurological symptoms of myelopathy. She showed significant improvement within 5 months of chiropractic care directed toward the correction of vertebral subluxations. The doctor in this case was using Gonstead protocols. We have a lot of other really interesting stories. We review an article in Medical News Today about how strong emotions actually synchronize the brain's emotional processing centers. This should be of great interest to those using open adjusting who have a commitment to seeing to it that their patients experience community as well as the ability to communicate with other patients. This month we reviewed the literature relative to the purported association between strokes and cervical adjustments. This is rearing its ugly head once again in the media. We've got the intellectual ammunition you need to refute this. You won't want to miss this one. Other interesting science pieces deal with the diagnostic capability of dogs and how a team of physicists say they can use lasers to see whether the universe stores information like a hologram. In our politics program, we will be discussing the Supreme Court decision concerning healthcare law. We'll talk about Medicare fraud detection, economic projections concerning chiropractic, and, as always, news from the various states and around the world. Our philosophy interview features Dr. Deed Harrison, the most published man in chiropractic. Listen to his wisdom concerning mechanism, vitalism, technique, and how they can be integrated into a functional synergistic model. So stay focused, share this information with your patients and community, use the On Purpose news releases, and if you're not using On Purpose slides, have a look at how they can turn reception room time into a positive learning experience. And finally, remember, when you're on purpose, you are not alone.